There's a new 3-digit number for people to call or text if they're experiencing a mental health crisis. 988 is the new National Suicide and Crisis Hotline.
Dr. Laura Saunders from the Institute of Living is here now to tell us how it can be helpful for people who need it during an emergency. Dr. Saunders, thanks so much for joining us. And I feel like I've heard a lot of buzz of this on social media lately, which is a good thing. And this is really something, though, that's been in the works for quite a while now.
Yes. Hello, friends. Happy Wednesday. Serious topic alert. We are talking about a new suicide hotline, National Suicide Prevention. They're actually calling it a lifeline number. And I like that because we are trying to allow people to feel connected. This has been on the rollout for many years. There's a lot of issues around funding and staffing, which still may be unfolding over time. What we know is that suicide is the second leading cause of death between 15 and 19-year-olds, right? Wow. That's a very sad and sobering statistic. About 20% of teens experience depression before they reach adulthood. And only 30% of depressed teens are being treated. So this is a crisis. I think it became much worse during COVID. I'm hoping as we're coming out of this, the only good thing that COVID has done for us is give us a little bit more of a spotlight on mental health and how important mental health is for physical health. But let's talk about 988.
Yeah. So the idea is that it's simple to remember. We always had a hotline, but I guess if you were in a crisis, would you be able to Google 1-800, whatever? I mean, this is just something to remember and not call 911 so often because they're not maybe trained to handle it.
Right. So that's part of the initiative behind this. So 988 is an easy to remember number. I mean, I do this work and I couldn't have told you the national suicide hotline number. So 988 is easy. It's similar to 911. And what they're trying to do is, avoid people, unless it's a true and dire emergency, calling 911 because a lot of police and fire officials are not equipped to manage mental health crises. So it's easier to remember. It's so that you get a trained professional on the other end. And it's ultimately one of the goals is to reduce the kinds of confrontations between law enforcement and people in very severe mental health crises. So we're trying to have a really strong effort to get people to know more about 988.
So if somebody does call it, what's it like? Like, who is on the other end?
So I actually thought about calling it yesterday as a test, but I just decided against that. But it is a trained mental health professional, and the goal is to have it be more local in the same way that when you call 911, you're not calling a national place, you're calling a local place. So the goal is for it to be local mental health agencies. But they have national centers as backups based on staffing. The other thing to consider is that in a crisis, what people used to use is 211, right? That's info line 211. And 211 really provided support around emergency mobile crisis. 211 is still available, but 988 is meant to be kind of like a suicide prevention lifeline, someone you can talk to if you are feeling desperate or feeling suicidal.
And it may not be, I guess, the person who is feeling suicidal that's going to call, but your loved one could call this. And what's going to happen, I mean, you do this for a living, does that phone call really become a lifeline? How do you transform someone from feeling or possibly acting on a suicide impulse to, okay, I'm okay now, I'm glad I called this number?
So you realize that when you actually make that phone call, that gives you a point of pause, right? And what we're trying to do in a lot of these situations is reduce access to lethal means and give people a point of connection to get them out of their own emotional pain and have someone else to talk to. So someone else for the individual to say, I'm very suicidal, I have nothing to live for, and have someone else outside of them say, I hear you, I validate you, let's look at some, resources to get you some help. So it gives you that pause button. And sometimes that pause button can be a lifesaver, whether it's the parent or a loved one calling, or the individual calling themselves.
Yeah,
Really important.
I think of like, I know we're going to run out of time. I want people to know about this, but I mean, I think of it's like where they have the phone booths on the bridge, hoping that someone will pick that up if they see someone, and you'd get it right then. So the ideal is 988. Just try and remember that 988, and wherever you are, 24 hours a day, 7 days a week, there's someone who could help you.
It's so important.
All right. Thank you so much. Really, really useful information.
Thanks, Dr. Saunders.